Now, on the heels of schools reopening all across the metro, the American Academy of Pediatrics, along with the Children's Hospital Association, released jarring new numbers when it comes to children and COVID-19. Cases and transmissions are quickly rising, and Nebraska has a higher percentage of kids with COVID than the national average. Reporter Rudolph Zenaida has more on the new data.
It's a startling discovery from the American Academy of Pediatrics. In a new weekly report with data from a number of states, from July 9th to August 6th, there were nearly 180,000 new child COVID-19 cases. That brings the total to over 380,000 since the start of the pandemic. It's an increase of 90% in child cases over 4 weeks.
In Nebraska, our rates are actually slightly higher than the U.S. In terms of number of pediatric infections.
Nationwide, about 9% of COVID-19 infections are in kids under 19 years old. In Nebraska, that number is 12%, and in Douglas County, it's 13%. 4% higher than the national average.
The 15 to 19-year-olds are where we've seen that really large increase.
Children's pediatrician and president of the Nebraska chapter of the AAP, Dr. St. Germain, says the cause of the increase could be related to more testing being done, but also summer activities.
I think people have left the house more, and especially kids. I think summer vacations probably accounted for some of that. More people were traveling and being exposed to more different groups of people.
Children are not immune to the virus and can spread it. Teenagers more than younger children.
Little kids and teenagers can get COVID. They can get very sick with COVID.
These new numbers add additional stresses to the already stressful back-to-school process. As case numbers keep rising, medical experts keep pushing safety protocols like wearing masks, which in Omaha is now mandated.
I think the best things that we can do are keep wearing our masks, follow the protocols that the schools have put in place to help prevent the spread among people when they do finally get to go back to school. And that's what's going to help us be able to get our kids back into school.
So the return to school is as safe as possible. Reporting in Omaha, Rudolph Zenaida, 3 News Now.
Now, Dr. St. Germain also says the data on child transmission from the other states is not recorded in the same way, and some states don't give out their numbers, so we should be more concerned about transmission locally than all across the country.